Did you know that thousands of years before the first modern hospital opened its doors in Europe, African healers were already performing complex bone surgeries and using sophisticated herbal anesthesia to ease their patients' pain? What if I told you that while much of the world was still treating wounds with fire, prayer, and hope, the foundations of modern medicine were already being practiced on African soil? This is not a myth. This is not folklore. This is a story they didn't teach you in school. This is the untold history of African medicine. Long before the word surgery entered any European language, in the ancient lands of Nubia, along the life-giving Nile, African healers were performing a procedure so advanced it still amazes surgeons today: trepanation. Trepanation is the surgical practice of carefully drilling or scraping into the human skull to treat head trauma, relieve pressure, and address neurological conditions. It sounds extreme until you see the evidence. Archaeologists have uncovered Nubian skulls with precisely carved openings. But here's the detail that changes everything. The bone shows clear signs of healing. These patients survived. They lived. They recovered. These were not desperate experiments. They were calculated, skilled medical interventions, performed with knowledge, precision, and care. And the brilliance of African medicine didn't stop at the skull. Across West Africa, among the Yoruba and many other nations, healers developed highly advanced systems of bone setting. Broken limbs were carefully realigned. Wooden splints were expertly carved. Medicinal poultices were applied to reduce swelling, prevent infection, and speed recovery. These were not crude attempts at care. These were refined techniques, passed down through generations of master healers, each building on centuries of tested knowledge. And then there's the part that truly forces us to rethink everything we were taught: pain management. While European surgeons were still strapping patients down, hoping they survived the shock, African healers had already unlocked the secrets of nature's pharmacy. They had discovered herbal anesthesia in the forests of Central Africa, in the highlands of Ethiopia. Across the savannas of the Sahel, healers cultivated and administered plant-based compounds that could numb pain, induce sleep, and make surgery possible without unbearable suffering. The Mandinka people prepared extracts from specific roots and barks to dull sensation before treating deep wounds or setting bone. And in ancient Egypt, yes, ancient Egypt, an African civilization, medical papyri like the Edwin Smith Papyrus, dating back to around 1600 BCE, described the use of opium poppies and other plants for pain relief during surgical procedures. So let me ask you this. If Africa was so advanced in medicine, why don't we hear these stories? Why aren't these achievements celebrated alongside Hippocrates and Galen? The answer is uncomfortable, but necessary. History, as it has often been written, erased African contributions. The narrative of progress was reshaped to exclude the very continent where humanity itself was born, where medicine, mathematics, architecture, and philosophy first took root. Consider Timbuktu in present-day Mali. Between the 14th and 15th centuries, it was a global center of learning. Scholars there studied anatomy, pharmacology, disease prevention, and surgical techniques. Manuscripts preserved to this day reveal detailed medical knowledge recorded centuries before the European Renaissance. In Ethiopia, traditional practitioners known as Deutera maintained medical systems that treated infections, digestive disorders, and even mental health conditions. They understood something modern science is only now rediscovering: the deep connection between mind and body, environment and wellness, community and healing. In southern Africa, the Tswana people developed treatments for snake bites using carefully prepared antidotes derived from venom itself. This wasn't superstition. This was early immunology, centuries before Edward Jenner would be credited with vaccination. African medicine was never just about treating illness. It was about understanding the human body as a living, interconnected system. It was about respecting nature and harnessing it with skill. It was about community care where healers were trusted guardians of collective well-being. And most importantly, it was evidence-based. African healers observed, they tested, they refined. They passed down what worked. They were scientists in every sense of the word, whether history chose to recognize them or not. If this story is opening your eyes, if you're learning something you were never taught, take a moment and subscribe to this channel, because there are countless more stories of African brilliance waiting to be uncovered, reclaimed, and celebrated. This is a journey of rediscovery, and you're invited. The legacy of African medicine is not ancient history. It lives on today. Modern science has confirmed the effectiveness of many traditional African remedies. Artemisia, used for centuries, became the foundation for artemisinin, one of the most powerful treatments for malaria. The rosy periwinkle from Madagascar revolutionized cancer treatment. African bone-setting traditions influenced modern orthopedic practices. But beyond the science, beyond the evidence, beyond the validation, there is something even more powerful to recognize. African medical knowledge represents humanity's first steps toward healing itself. It is compassion turned into action, observation transformed into intervention, community care elevated into an art.
When you see a surgeon's steady hands today, remember the Nubian healers who first opened the skull to save a life. When anesthesia eases pain before a procedure, remember the African herbalists who discovered that plants could quiet suffering. When a broken bone is set, remember the West African masters who perfected that craft generations ago. This is not just African history. This is human history. And Africa is not a footnote. It is the opening chapter. The next time someone calls medicine a purely Western achievement, remember this truth. The same soil that gave birth to humanity also gave birth to the knowledge of how to heal humanity. Africa didn't just contribute to medicine. Africa pioneered it. And a truth once buried, once ignored, once erased, is finally rising again. One story, one discovery, one awakening at a time.